My name is Kenneth C. Chessick, MD. I'm a trial lawyer as well as a general surgeon and a surgeon who has done cardiovascular heart and lung surgery as well. My law practice is devoted entirely to the representation of victims of medical negligence. The most common causes of death in America are number one, cancer, number two, medical errors, and number three, cardiovascular disease, which includes diseases and problems of the heart, blood clots, both in the legs into the lungs, and stroke. Now, the most common causes of death due to medical negligence are the delay in diagnosis and treatment of cancer. That's number one. But the second most common cause of death from medical negligence is the failure to diagnose and treat diseases of the heart and lungs. And that includes the failure to diagnose and treat blood clots, heart attacks, and strokes. All deaths from medical negligence are 100% preventable. Deaths from negligence should never, ever occur. By definition, it's the failure of a doctor to act like a reasonably careful doctor in making the diagnosis and treating the patients. All medical negligence deaths are preventable, and that includes deaths from blood clots, which is the main topic of today's discussion. The prevention of blood clots is something that can be, must be done when it's predicted. And you can always predict when most blood clots are going to occur because they occur almost always in high-risk people. If you identify the patient who's at risk for a blood clot, you can prevent it, and when it occurs, you can treat it. By doing that, you can save a life. If you don't make the diagnosis of people who are prone to blood clots and a blood clot develops with no treatment, that patient frequently will die. And that is a preventable death. All diagnoses, whether of cardiovascular disease, blood clots, or cancer, or everything else, are made in three very important ways. The most important part of making a diagnosis is to take the physician or treating individual must take a detailed history, must take a detailed, ask a bunch of questions of the patient, and then ask follow-up questions based upon the responses. The second most important part is a detailed, careful physical examination. Detailed history will give you the clue to the diagnosis 80% of the time. Physical examination will add another 15%, and then testing, which can confirm the clinical impressions, picks up the remainder. In order to take a detailed history, however, it's a time-consuming task. The conduct of the physician, and that's, by the way, we're always talking about the conduct of the healthcare provider. It's a time-consuming, sitting there with the patient, taking detailed history, asking questions, listening to the answers, and then asking follow-up questions depending upon the responses. It just takes time and thought and effort. And unfortunately, negligent doctors don't want to spend that time. It's not that they don't have the knowledge. The vast majority of the time they do. They just didn't take the time to do that. Similarly, a physical examination takes time. It's something that you do one-on-one with the patient. You use your five senses of vision, touch, smell, and hearing. We usually don't use taste. But look at the patient, understand what you're seeing, touch them, feel the areas that are involved. That's key to making all physical examinations. You know, blood clots have been around for centuries. Back in the 1870s, there was a German pathologist by the name of Rudolf Virchow who identified the situations in which blood clots occur, and they now bear his name. They're called Virchow's triad. And it involves stasis or lack of flow of the blood, trauma, and what's called a hypercoagulable state, conditions which predispose the patient to forming blood clots. Now, these were true in 1870s, they're true in the 21st century now. Now, when we talk about stasis, we're talking about the fact that the blood in the veins, and blood clots almost always arise in the veins of the legs and the pelvis, occasionally in the heart, but it almost always occurs because the blood is not flowing. Frequently, that's a result of lack of movement of the legs or lack of movement of the patient. That may happen to people who are at prolonged bed rest. If they don't have their leg muscles contracting and pumping the blood to keep the blood flowing back to the heart, that blood sits around and it can form blood clots. We see it in long-haul drivers. We see it in salesmen who spend a lot of time in the car. I've even seen it in people on airplanes. There are certain conditions that lead to stasis or lack of free flowing of the blood. Varicose veins are one example. Those are the veins that pop out in people's legs when the valves in those veins don't work properly. Those can also predispose to blood clots. Sometimes there's an abnormal communication between an artery and a vein in the legs or elsewhere, and it's called an AV fistula, arteriovenous fistula, that can cause some stasis. Patients who have, in addition to being in bed because of debility, post-operative situations, people have had casts or placed on their extremities, on their lower extremities, that also creates stasis, and that's a 1/3 of Virchow's triad. You don't need all three to develop a blood clot. Any one of those things can do that. We see stasis in certain conditions of the heart. Atrial fibrillation, which is a circumstance when the upper chamber of the heart doesn't contract properly. Blood can sit around in certain parts of the atrium. It's called the atrial appendage, and they can form clots. So rather than a blood clot forming in the legs or the pelvis, it can form in the heart. That's well known. In fact, that's a major cause of morbidity and mortality in people with atrial fibrillation. It can be other things with like indwelling foreign materials in the heart, an abnormal mechanical heart valve or a pacemaker that's inserted through the veins into the inside of the heart, certain kinds of wires and tubes and devices. These foreign bodies can result in stasis of the blood around those devices, clots forming. And other situations where blood stasis occurs is a heart attack. Sometimes the clots can form on the wall of the inside of the left ventricle of the heart, where there's been some previous injury to the heart as a result of a heart attack. Clots can form there. The problem with all of these clots is that they can break off, and blood flow when in the veins returns to the heart and then is pumped to the lungs. And when these blood clots are pumped to the lungs, that's called a pulmonary embolus. Pulmonary embolus is a major cause of death in all patients, all patient groups. And so it's very, very important to identify people who are at risk for blood clots and therefore from pulmonary embolism. Other pieces of history that you can identify, of course, is that the patients had trauma to their body parts, crushing injuries or penetrating injuries, gunshot wounds, automobile accidents, surgical operations, broken bones on the pelvis and the hip and the upper bones of the thigh, the femurs. Those all can predispose to the formation of blood clots. In fact, anything that injures the lining of the veins, which is the tubes that bring the blood back to the heart and then from there to the lung, anything that interferes with the integrity of the lining of the veins, clots predisposes the blood to clot. And when clots can form, that means they can break off and develop pulmonary injuries, pulmonary emboli, pardon me. Other historical things that a careful, detailed history will determine is whether the patient has what Virchow called a hypercoagulable state. There are certain conditions which predispose to blood clotting. One of the most common is cancer, of course. All kinds of cancers, especially solid cancers, cancers of the breast and the lung and the liver, can all increase the ability of blood, the propensity of blood to clot. Diseases of the blood, particularly the white blood cells, that frequently can cause problems with clotting, increasing the coagulability of the blood and increase the likelihood of a blood clot forming and therefore pulmonary embolism forming. Certain conditions of increasing numbers of red blood cells, the little cells in our blood that carry the oxygen. Some patients with lung diseases like emphysema or people who live at high elevations, they actually can increase the number of red blood cells in their system, and that increases the propensity of blood to clot. That condition is called polycythemia. You can have conditions like leukemias and lymphomas and anything that increases the number of platelets. Trauma itself increases the number of platelets. Platelets are the part of the blood that is part of the system that forms clots. And so history is critical, and that's why I'm spending so much time on this, because this is the most common flaw, error, negligent error that doctors can make, which can overlook both the prevention of blood clots as well as the diagnosis and treatment when they do occur. And both are extraordinarily important. Blood clots can be prevented in many, many, many patients. Not all, but in many. And what do you do? Well, we all know after surgery, we try to mobilize patients, get them walking as soon as they can. Today, hip surgery used to be a major cause of blood clots, and it still is. But many, many patients after hip operations are mobilized and get up walking the day of surgery. The sooner you can mobilize a patient and prevent them from sitting and lying in bed all day, allowing stasis, especially superimposed with hypercoagulable state from trauma or surgery, that's so important. We use compression stockings, pneumatic compression devices, which help pump the blood in the legs of people that have to be at bed rest. Whether or not compression stockings work is open to debate. But there are other conditions. We talked about varicose veins is another one. Varicose veins are conditions where the veins in the legs pop out, and what's happened is that the valves in those veins have stopped functioning properly, and the veins dilate and blood doesn't flow rapidly through those varicose veins, and that can lead to blood clots. Blood clots, skin can lead to blood clots inside the muscles, and those are particularly risky because those are the ones that can break off and go to the heart. So those are some of the preventive things that we can do. But there's medications as well. Heparin, of course, is a mainstay of anticoagulation. Heparin is a medication which prevents blood from clotting, or watch the dosage of it because too much can lead to bleeding. But the failure to treat somebody with heparin, or both prophylactically to prevent a blood clot, or when they do actually get it, is negligence that can lead to death. There are other drugs. Low molecular weight dextran is another one that's given. There's oral medications, Coumadin, which is an anticoagulant, which prevents blood from clotting. Eliquis is another one. There are other ones as well. Plavix is something that affects the platelets, as does aspirin, and are used in circumstances like that as well. So these are all of the things that can be done to prevent a blood clot in the legs or in the pelvis or elsewhere, and which can break off and lead to fatal pulmonary emboli. With prompt diagnosis and treatment, most deaths can be prevented and avoided. Medical negligence, I'm going to say this again, is 100% preventable. Deaths from medical negligence should never occur. By definition, that means that this doctor or healthcare provider was not acting like a reasonably careful person, doctor of similar training in the same or similar circumstances. That should never occur. They don't have to be the best, the smartest. They just have to be as good as what a reasonably careful doctor would do in the same circumstances. They can all be prevented. And that's really, really critical. Now, I want you to know that medical negligence is really only, especially resulting in death from pulmonary emboli, happens to a very, very small percentage of doctors. The vast majority of physicians do not commit medical negligence. They act like a reasonably careful doctor would do in the same or similar circumstance. But there are a small cadre of negligent doctors, and oftentimes they're sued multiple times. Fewer than 2% of all doctors are responsible for more than 50% of all reported settlements from medical negligence. And 1% of physicians are responsible to 1/3 of all paid claims. Medical negligence should not occur. The deaths from medical negligence, from blood clots going from the legs to the lungs, should not occur. There are other treatments that we haven't talked about, things like filters that you can put in. But the point is that these things should never occur. If you want to talk about this further, please give me a call. I'd be happy to discuss your case with you. Thank you.